The government is yet to declare a fifth wave of coronavirus infections despite the rising numbers. At the same time, the rate of those getting vaccinated remains low. CSIR Senior Researcher Ridhwaan Suliman joins me to help us make sense of the numbers. Good evening, Doctor. Thanks so much for your time. So tell us about the waves in South Africa. Are we in a fifth wave, and what are the numbers looking like comparative to previous waves?
Yes, we are indeed well into a fifth wave of COVID-19 infections in South Africa. In fact, we entered the fifth wave at least about 3 weeks ago. And based on previous waves, I say that based on two particular thresholds or indicators. The first being when the number of new cases per 100,000 population exceeded 5 per day, and also taking into account the testing when the test positivity rate breached the 10% level. Now, we breached those levels at least 3 weeks ago, and we're well into the fifth wave. In fact, over the course of just the past week, we're now seeing a slowing down of the rate of new infections, indicating that we actually may possibly be nearing the peak of this fifth wave. Currently, over the past week, we're averaging just about 7,500 new cases per day. That figure, as mentioned, has been slowing over the past week, still increasing, but the rate of increase is slowing. And it's about 32% or about a third of what we saw at the peak of the previous Omicron BA.1 surge. So we're seeing a high number of infections currently, primarily in Gauteng and KwaZulu-Natal, but certainly, as we saw with Omicron BA.1, less severe outcomes, lower hospitalization rates, and far fewer deaths.
So let's talk a little bit more detail about those hospital admissions. Can you give us a percentage of people who are being hospitalized with serious or severe complications?
So the last week saw just over 2,600 new hospital admissions in hospitals across South Africa. That figure increased by about 20% compared to the previous week. I don't quite have the percentage of cases or the hospitalization rate, but what I can say is that those new hospital admissions are far lower than what we saw in previous waves. It's about also a third of the peak of the Omicron BA wave. And we know that in that wave, there were far fewer hospitalizations compared to the 3 previous waves. So certainly lower rates of hospitalization currently.
Let's talk also about the mortality rate, because as we see less hospitalizations and severe cases, we also see a drastic decline in the number of people who die as a result of COVID. Talk to us about the comparison of cases reported versus deaths.
Yeah, so indeed, there is that decoupling that we started seeing during the BA.1 wave over our summer months, and that decoupling between infections and severe outcomes of hospitalization and death have continued. We do need to bear in mind that hospitalizations and deaths are lagging indicators, and they likely will continue to increase due to that lag. But there's a significant difference between the rate of increase in infections and the number of deaths. Currently reported deaths in South Africa averaging just about 34 new deaths per day. That's across the country over the past week. And that figure, although every death is one death too many, it is significantly lower than the number of deaths that we were seeing, at least compared to the first 3 waves. So I think that is encouraging news, and we know that high levels of population immunity in South Africa, both through acquired immunity but also through past infection, are contributing to this decoupling that we're seeing, and this lower rate of severe outcomes and lower hospitalizations and deaths.
We know that Gauteng is one of the most densely populated provinces in the country, and so far since the start of the COVID-19 pandemic globally, here in South Africa, Gauteng has been one of the leaders in terms of the number of cases identified in each of the waves. Gauteng has also presented those high number of cases first before any other province. Is that also the trend you're seeing in this fifth
it is spreading throughout the rest of the country, as we saw with the previous wave, starting in one or two provinces and then rising in the rest of the country. We're now seeing, particularly in Western Cape, a surge in new infections, with new cases up just over 50% compared to a week ago. But all of the other provinces are also starting to see an increase now.
As we have seen the end to the state of national disaster and a relaxation of more of those restrictions and, distancing measures, sanitizing, number of people who are allowed to attend events, all of those elements that we've seen reduced. Have you seen a jump in cases corresponding directly to that time period, or is that very difficult to determine?
It's difficult to make a direct correlation between those events and the rise in infections. There just isn't sufficient data to make firm conclusions. But certainly the increase in gatherings, particularly over the religious holidays over the past month, as well as more people gathering, may have contributed to the rise that we have been seeing in infections over the past month. But I think more so it's probably a result of the evolution of the virus and the new mutations that are currently dominant in the country. We know the previous 4 waves, each were dominated by a different variant that emerged and drove infections. And currently this 5th resurgence is being driven by the emergence of the BA4 and BA5 sublineages of the Omicron variant. These are more transmissible than what we've seen before, even more transmissible than the original BA1 Omicron strain. And I think this highly transmissible variants currently in circulation are responsible for the rapid rises that we're seeing at the moment.
Thank you so much for taking the time to speak to us and bringing us that information. That was CSI Senior Researcher Dr. Ridhwaan Suliman.